Victor Baez, can I take a vitamin MK7 every day? For the latest in health-related information and ways to save your life, check out the newsletter. Of course you can. One of the things that I recommend for a lot of folks, here's the thing. So let me go back to Peter's comment, D3 and K2. You see so many supplements with D3 and K2 together. They typically will have 1,000 international units of D3, which the vast majority of time is not nearly enough, and maybe 100 micrograms of K2, which to me is not nearly enough. You look at the studies, most of the studies that have dealt with K2 usually use at least 400 micrograms. For me, a D3 would be 5,000 minimum. Now, so you could say, well, okay, I'll take 5 of these vitamin D3 K2s. That's not a cost-effective way to do it. I don't take any of the D3 K2 together kind of things just because of those issues. Let me add another aspect to this issue as well. D3 in mega doses can be very dangerous. It can kill you. It can wreck your kidneys. K2 is not the same. K2 in very big doses, mega doses, is relatively harmless and in fact is given and has been shown to be helpful for people with osteoporosis, as in 45 milligram, as opposed to the 100 microgram levels that you tend to see in these products that have D3 and K2 together. So again, it's that urban myth thing. Oh, well, you want to get calcium out of your arteries and into your bones. So you take the two things that help, the D3 and the K2, and you put them together. I just don't take that for the reason that I just discussed. It's like these things, where they try to make a car into an airplane or a car into a boat. It's not a good car and it's not a good boat either. Well, you try to make a vitamin D3 and K2 together. It's not a good vitamin D3 supplement and it's not a good vitamin K2 supplement either. So again, I'm sure I'll get a lot of haters for that, but that's my position. And yes, you can take it every day. Don't overdose on vitamin D3. We've seen plenty of cases of it, and we've had a few people come on board and talk about their episodes with it. One of them actually had started to get a significant decline in her kidney function. We stopped her K3. She was seeing a doctor that uses these 50,000 international unit doses, and those are meant to be given once a week or less. They're basically meant to get somebody back up to a normal level that's been really low. This patient misunderstood, and that's the most common problem. One of the most common problems in terms of vitamin D3 overdose, there's a misunderstanding between the provider and the patient, or there's a patient thinking if a little bit's good, a whole lot's got to be a lot better. And they take these mega doses of vitamin D3 every day, which they're not meant to do. We got that when the patient came in to see us for her initial, we got a panic value back from the lab. I called her. She stopped taking her D3. We monitored her kidney function, which was, as I said, had declined during that overdose period. Within about 3 months, it had come back to normal. She was relatively young, in her 50s, and it became a good story to tell. Vitamin K2 is not going to do that. D3 will.